Hey guys, so I'm at work at the hospital, and as some of you guys probably know, I do, in addition to diagnostic radiology, I do something called interventional radiology, and I do specifically non-vascular interventional. So things that have to do with different organs, biopsying different organs, different tumors, drainages, that kind of thing, but nothing that has to do with any kind of blood vessel like an artery or a vein. And I do that with image guidance. So usually ultrasound or CT, I use that to guide some kind of needle into one of these structures or abscesses or tumors to take a sample or put a drain in or something like that, or do something to help treat the patient. So I'm going to go over a couple of procedures that I did today to show you guys what those were all about and give you guys a little bit of insight into what a radiologist does in a Canadian hospital. Okay, so one of the first procedures I did today was an ultrasound guided breast biopsy. So we're going to start with the mammogram because that's what we started with for this lady. Typically these kinds of things, present, somebody feels a lump in their breast. So that's why doing a self-exam and getting also a clinical breast exam is important. And sometimes they just, we find them on screening mammography. That's why people do screening mammographies in our mammograms, in our country. And we find things like this. I mean, this is a fairly obvious one, and you guys also have the arrow sign, as we call it, in radiology, pointing at this thing here, which looks like a pretty scary looking mass. It's got sort of, spiky edges to it. We call it spiculated margins. It looks kind of like a star in a way. So that is definitely something that stands out on this. And in radiology, basically, symmetry is your friend. So this is the right breast, and this is her left breast. You can see there's an obvious asymmetry between the two sides in terms of this sort of tissue. Looking in a slightly sort of coming in a slightly different configuration, you could have this kind of thing seen on both sides, not as sort of star-like or stellate or spiculated looking as this. And it could just be normal breast tissue in a woman. So sometimes, that can create difficulty. You're wondering, okay, is this just normal tissue or is it actually like a developing cancer? So, you kind of want to be careful with that. And that's part of why we do so much training and we see thousands of these cases every year that are normal. So it helps us pick out the abnormal. And this is a slightly different view with the same thing in the right breast there. That's clearly not there on the other side. So it's abnormal. Okay, so I'm just showing you guys this in paint because I'm trying to crop out the patient's name. I don't want to accidentally take a video of it to maintain patient confidentiality, but when we see something like that thing on a mammogram, we flag it and the patient gets an ultrasound. So on ultrasound, here's the patient's sort of skin surface. The ultrasound probe comes down on their skin, shoots sound waves through, which reflect back, or sometimes they don't reflect back depending on what we are looking at, and that creates the image. The computer kind of generates this image. So we've got this is normal breast tissue, or I should say fatty breast tissue. In this lady, it's pretty much all fat. It's kind of a mix of intermediate grays to lower grays, and then we've got this obvious focal mass-like thing that is dark. We call it hypoechoic because it's dark, and it's got those irregular margins we were seeing on the mammogram. All this irregularity here and this shadowing, it's actually blocking the sound beam. That's because it's dense, and that's also a sign of something bad along with the irregular margins. Okay, so a biopsy is basically taking a sample from something, tumor in this case, and we send it off to the pathologist who look at things they slice it up, they stain it, they look at it under microscopes, they figure out what kind of cells these are and what exactly this tumor actually is. Is it something benign or is it something malignant? So as a radiologist, I do an image-guided, an ultrasound-guided biopsy of this lesion. So this is my needle. It's coming slanting in from the skin surface up at the top here, and you can see it's going through the middle of the mass, and this is my first pass through it. It just kind of it reaches out kind of like a little jab into the mass, and it grabs a little piece of the tissue. And I took 3 of these, and then we send it off to the pathology lab, and we find out what it is afterwards.